Recently, I had emergency surgery for appendicitis. It was a rather forceful reminder that just because we have Parkinson's disease doesn't mean we can't get other illnesses. So after I was assessed in the emergency room, I underwent surgery that same night. The whole process was challenging, both in the hospital and afterwards during my recovery. Not only because I had some post-surgical complications, naturally, but also due to my Parkinson's disease. Now that I'm on the mend and feeling much better, I thought I would share some issues that you need to be aware of, and some things you can do to make the potential experience of surgery safer and less complicated. Now, my appendicitis and appendectomy were obviously not planned, so I didn't have time to prepare. However, there are many procedures that are elective, booked ahead of time, that you can prepare for. Unfortunately, I will have to start off by telling you that the surgical process is more difficult when you have Parkinson's disease. Not that you should avoid any surgical treatment if it's offered to you. That really wouldn't be a good idea. But let's look at those challenges and how we can better prepare for them. And so I'd like to share with you 12 potential issues that may arise and that you need to consider if you have Parkinson's disease and are undergoing any type of surgery. So tip number 1, first of all, prior to going for surgery, you may want to get an appointment for what we call a preoperative assessment, where you meet with the anesthetist before your surgical day. These types of appointments are helpful both for you and the clinicians involved in your anesthesia and surgery. This is an opportunity to discuss other health problems like your Parkinson's disease, your medications, and so forth. Anything that may affect your surgical process. And this may be a good time actually at your pre-op consult to discuss whether regional or local anesthesia instead of general anesthesia is possible for your particular procedure. It really depends. But those types of local anesthetics are usually easier to recover from than general anesthesia. And if general anesthesia is going to be used, then the anesthetist can think about using drugs that are better for Parkinson's patients in general. Tip number 2 is about your Parkinson's meds. And you have to consider what your surgery will entail and how you can take your Parkinson's medications. And it would actually be an advantage if you can see your movement disorder specialist or neurologist prior to discuss your medications. Because it is important that you continue to receive your own meds at your scheduled time. This means up to the point of surgery and as soon after your surgery as possible and throughout your stay in hospital. You should clarify with your surgeon about whether or not you can take your dose of regular Parkinson's medications with a sip of water prior to surgery and what the plans are for taking your PD meds after surgery. For example, in the case of abdominal procedures where it may not be possible for you to take your meds orally or by mouth, they may be able to give them to you by alternative routes, for example, intravenously or via a nasogastric tube into your stomach. Or maybe you've consulted with your neurologist and switched to meds that can be given subcutaneously via needle or via a patch. But if you are able to take your medications by mouth as normal after surgery during your hospital stay, then you may want to take your own supply. I did that. And you need to ask if you can take your own pills and give them to yourself at your normal times, because in hospital, meds are usually administered by nursing staff, and that happens at very specific intervals, naturally, which may not coincide with your time. And as you all know, and as I found out, not getting your meds on time can be a real issue. Post-surgery, your recovery can be more challenging if your PD symptoms are aggravated. Tip number 3. With regards to the medications you receive in hospital, post-operatively, and during recovery, you need to be aware that there are medications that may interact with your PD medications. I'll provide some more details in my written blog, which will be linked below. But for example, if you're on an MAO-B inhibitor such as rasagiline or Aslect, there are a number of medications that may dangerously interact with it, such as meperidine, also known as Demerol, or tramadol, both of which are commonly used for pain control. You don't necessarily have to know a lot of pharmacology or have to know about all the potential drug interactions that can occur, but you should at least be aware that there may be some issues and make sure your surgical team is aware as well. Tip number 4, there are also certain medications that not only may interact with your medications, but may actually worsen your Parkinson's symptoms specifically. Metoclopramide, for example, is a medication that's given for nausea. But that medication also blocks dopamine receptors, making your PD motor symptoms worse. Such is the case with some typical antipsychotics such as haloperidol or Haldol. So you have to be aware. Tip number 5. There are also some medications that may aggravate your post-operative course, such as pills that help with sleep and anxiety, which you often can get, but these happen to worsen your balance, making you at increased risk for falls, or other medications that may lower your blood pressure as a side effect, which again can be risky if you already have trouble with orthostatic hypotension, which happens in PD. That's when your blood pressure drops if you stand up too quickly. So that's something you need to be aware of as well. Tip number 6, knowing that those of us with PD often face a longer post-surgical recovery, and this can be due to a variety of reasons. But one of them is getting slower to get moving or mobilizing. Mobilizing well enough and safely because of an increased risk for falls may take a little longer and require in-hospital physiotherapy. So it's always a good idea if you need to see a physio or occupational therapist early on in your post-operative course, once you've had the okay to start moving around. This can really help as well. Tip number 7 is about delirium. Delirium is an acute episode of confusion and can include hallucinations, agitation, and delusions. And this type of complication is more common in those of us with Parkinson's disease, especially if you have any cognition issues to start with. Having someone you know with you to reassure you and orient you may really be helpful, as are certain medications, but those again must be chosen carefully in the context of your Parkinson's disease. Tip number 8. You may be at higher risk for aspiration because the majority of us with PD have some degree of swallowing dysfunction, which can be made worse by anesthesia. Awareness of this potential problem, getting a dietitian or speech-language pathologist consultation to advance your diet carefully after surgery and help with aspiration may be helpful. Tip number 9. Because of potential aspiration, also because in PD there can be rigidity or abnormal movements in the voluntary muscles in the chest wall, as well as the upper airway muscles, there's an increased risk for not being able to breathe deeply, clear your secretions, and that puts you at an increased risk for pneumonia. So seeing a respiratory therapist to help with deep breathing after surgery may be helpful. Number 10, I briefly mentioned the blood pressure issue earlier, but blood pressure really can fluctuate after surgery, and those episodes of low blood pressure can get worse if you already have them. So if you get up too quickly and without support, you may be at increased risk for falls. So always, especially early on, have someone around you try and help you as you go from lying down to standing, and this will help you avoid any falls. Tip number 11, this is about your bladder. Urinary dysfunction is a common problem in Parkinson's disease, and this may make you prone to urinary tract infections, especially if you've had a catheter, which in turn can result in worsening of your Parkinson's symptoms, which of course we don't want to have happen. And tip number 12, the last one I'd like to mention, is constipation. Constipation, getting your bowels moving, is often a challenge for most people after surgery, and this is particularly aggravated in those of us that have PD. So activating a plan in terms of bowel meds to address potential constipation issues post-operatively is really very important. So as you can see, there are a number of potential issues when it comes to having surgery in the context of your Parkinson's disease. If you know about your surgery ahead of time, then personally I would recommend that you see a neurologist or movement disorder specialist to discuss any potential issues that may arise depending on the surgery and your personal PD situation. Formulate a game plan together with them, and then have them communicate, preferably in writing, with your surgical team. So although I wish you never have to use it, I hope you found some of the information helpful. Like any challenge we face with this disease, knowledge is power, and being aware of potential issues and planning ahead can really help avoid, or minimize at least, any potential complications. If you have any suggestions for topics that you'd like me to cover, then please leave them in the comment section below. You'll also find my links to my social media and my website in the description box. And if you'd like to get notifications for any new content that I produce, the notifications and subscription buttons are below as well. Farewell for now, and remember, we may not have a choice in our diagnosis, but how we face the challenges that this diagnosis brings is ours to determine. So do whatever it takes to allow you to thrive, not just survive, with your disease. Thank you.